Thank you, Mr. Speaker. Mr. Speaker, every year I judge whether or not to support a budget proposal based on how it will impact those who cannot advocate for themselves. I try to assess each budget by how effective we are in funding programs and services that help those who depend on us for their very survival. Last year, the governor's budget proposal slashed funding for special needs services, but a small and dedicated group of legislators banded together and refused to support any budget that did not reinstate millions of dollars to help move families from waiting lists to independent living. Our voices have been heard. I'm pleased to say that the budget before us tonight, while fiscally prudent, increases funding in areas where it is most needed. So why should we support this budget? First, it increases by 10% and millions of dollars funding for the waiting list for individuals with intellectual disabilities. This is the funding that cares for adults with special needs. Many of the families who care for an adult child with special needs have done so for many years while they have patiently waited their turn to obtain the desperately needed services they require to properly care for their family member. Every legislator in this House has constituents who are in this position. It's time to help these families, and this budget accomplishes this objective. Mr. Speaker, another aspect of this budget that deserves mention is the 100% increase in funding that has been given to the mission of working for those who suffer from Tourette's syndrome. This funding provides critical services to Pennsylvanians who suffer from Tourette's syndrome and their families. The governor's budget zeroed out this line item altogether, but in the budget before us, we have increased it 100% over last year's budgeted amount. The funding will support the needs of individuals with Tourette's syndrome across the Commonwealth. Thousands of school children in Pennsylvania have been identified as having Tourette's syndrome, and many more go undiagnosed or have chosen not to be identified at all for fear of being stigmatized. The services that would be provided as a result of this funding include information and referral, outreach programs, a dynamic website, a toll-free hotline for parents, teachers and caregivers, newsletters, support groups across the Commonwealth, non-legal advocacy, and a family conference. The funding will also provide information and training to schools, teachers, counselors, coaches, nurses, physicians, professionals, speech pathologists, family members, and peers. To help the community at large, the funding will provide training and outreach to underserved areas of the Commonwealth, including the most rural and remote communities, as well as some of the most dangerous neighborhoods of the inner city. Many parents who care for a child with Tourette's syndrome cannot afford legal counsel nor an advocate and need assistance in navigating the complicated IEP process. This funding will also assist these families work with their local school districts to better understand students with Tourette's syndrome and to make recommendations for the supports that will help these students to be successful in school. Mr. Speaker, the most compelling reason of all to vote for this budget and to restore full funding for the mission of helping families who deal with Tourette's syndrome is that many of these families have absolutely no other place to turn as they fight for services and supports for their child. The families to whom I refer cannot afford legal counsel nor professional advocates to assist them fight it out with their local school districts in their efforts to help their child. They desperately need this funding. Mr. Speaker, I want to add that this budget also adds funding to the Department of Health to restore funding for diabetes programs, biotechnology research, poison control centers, and support services for those with lupus, epilepsy, and ALS. It increases funding for autism intervention and services significantly. It also continues the multi-million-dollar investment in additional lottery funds for expanded home and community-based services for seniors and adds millions of dollars for long-term senior care. I'm also pleased it includes an 11% increase for domestic violence centers, a 14% increase for rape crisis centers, and adds millions of dollars to child care services to reduce the waiting list. I'm also proud to say that this budget funds a pilot program through Pennsylvania workforce investment boards to help underemployed Pennsylvanians find work. While this budget is far from perfect...
Gentlemen, please suspend. Your time has expired.
Thank you, Mr. Speaker.
Speaker thanks the gentleman.